Welcome back once again to Recovery Coast to Coast, the only program in America on the air 5 nights a week, 2 hours a night, talking about addiction with a focus on recovery. Great to have you with us tonight. We have a special guest in the studio. Jim Vollendroff is with us. He is the Director of Behavioral Health and Recovery Division at King County. He directs the implementation, policy, and coordination of mental health and substance use disorder prevention and treatment services. He manages a staff of about 150 people and a budget over $400 million. He's going to talk a little bit about the legislative forum that is coming up on December 7th, and then we're going to talk a little bit about Jim, a little bit about his journey. He's a guy in long-term recovery. Jim, welcome to the program.
Hey, thank you, Neil, and it's great to be back.
Well, it's always good to talk to you. It's always good to be a part of the forum. I've had the distinct privilege and pleasure to be able to moderate the forum for the last, 7 or 8 years. I kind of lost track. This is the 20th annual legislative forum. It's coming up on December 7th, going to be again at Town Hall.
Yep.
And my understanding is right now we've got over 950 people already signed up.
Yeah, it's incredible. 975 as of this morning.
Oh, my goodness.
And growing. And we have room for more. And
There's
so
room for you.
Yes, there is.
And I want to repeat this a couple of times. If you're interested in joining us that night, and we certainly hope that you do, there'll probably be about 20 or so legislators, elected officials, legislative staff, city, county, state level, federal level, all the way down.
This year, Neil, I also want to point out that King County Executive Dow Constantine will be there. And in addition to Executive Constantine, Linda Rosenberg, who's the president of the National Council on Behavioral Health, is attending to talk to us about what's happening at a national level and how does that fit into what's happening locally.
Wonderful. And, of course, Dow Constantine has been a longtime friend
Absolutely.
of the treatment and recovery movement. It's going to be at Town Hall, which is a wonderful facility. It seats about 1,100 people.
That's right. The evening is from 6 to 8:30 p.m., and the first hour we have set it up where we've invited our representatives to meet with their constituents. So when you sign up, you identify which legislative district you live in, and we'll be letting the legislators know who's coming and who they can expect from their particular district to come and speak with them. So you will have an opportunity to actually meet with your representative and ask questions about behavioral health and help advance policies. We'll be talking about what our legislative agenda items are. If you're inclined to support some of those legislative agenda items that we have, it'll be an opportunity for you to meet with your legislators.
So there'll be various tables around in the foyer, which we've done in the past.
Correct.
And individuals will find out who their representative is and sit down and share one-on-one, a very unique opportunity to go one-on-one with these people.
Absolutely. And there is nothing like people in long-term recovery sharing their story with their representatives. And that's what this evening's all about.
What has been the reaction in years past of doing this?
Well, the program is in its 20th year, and we have grown significantly, as you've seen over the time that you've been a great partner of ours. And it just continues to evolve and give us opportunity to put a face to behavioral health and reduce stigma and advance public policy in regards to behavioral health. Adding things like conversations with the legislators is new for us, and we continue to listen to feedback from people to make the event even better and greater each year.
In addition to King County Executive Dow Constantine and Linda Rosenberg, who is the National Council on Behavioral Health President and CEO, and you will be giving your talk as well.
Yes.
But something for me that has always been the highlight is the sharing of stories.
Yes.
Of people getting up and sharing with one another in the auditorium and with the legislators what it was like, what happened, what it's like now.
It's no doubt the highlight of the evening. The highlight of the evening is hearing from people and hearing from family members. And sometimes those stories do not have miraculous endings. Sometimes they end in tragedy. And that's unfortunately part of the story as well. But others end in a miraculous recovery and resiliency in people whose lives are forever changed, and it really is the highlight of the evening.
Jim Vollendroff joining us on Recovery Coast to Coast, Director of Behavioral Health and Recovery Division of King County. He is the senior leader in King County's Department of Community and Human Services. Tell me about some of the priorities coming up in the next year.
Well, we have a number of priorities, and certainly with the election that just occurred, one of our highest priorities is to maintain the Medicaid expansion in this state. a significant number of individuals in this state received Medicaid as a result of the Affordable Care Act, and we believe it's critical that we maintain that expansion of Medicaid as one of our priorities. In addition to that, we are concerned with issues. Many people have heard about challenges with the state hospital and a backlog of getting patients in and out of the state hospital. We're interested in finding alternatives to sending people to the state hospital in the first place. So I have a staff of over 30 designated mental health professionals whose job it is, Monday through Friday, 7 days a week, to determine and evaluate whether somebody should be involuntarily committed. And to the degree possible, Neil, we want to divert people from that deep into the system. We don't get well in hospitals. We get stabilized in hospitals, and there's a vital role that hospitals play, but we get well in our own community. And so we want to divert people from the state hospital and create step-down opportunities and diversion opportunities at the local level. That's one of our priorities. Another priority for us is we have a significant workforce shortage in King County. We can't hire and staff up our programs fast enough to meet the demand. And therefore, programs have vacancies, and therefore clients are not able to be seen as quickly as we can. So we need to reverse that trend. And one of the things that we're going to be asking our friends at the Washington State Legislature is to be looking at things like loan repayment programs so that we can attract and retain people to provide an adequate workforce.
How would that work?
Well, there's an existing loan repayment program at the state. What we're asking for is that be opened up and that mental health and chemical dependency professionals be added to that group of individuals who could, in fact, commit to providing services for X number of years, and assuming that they do that, then their tuition would be paid back.
Wow.
Yeah, that would be incredible.
I can't see what objection would be to that.
Yeah, I think that we've got some great partners going forward to move that forward, and I believe we'll be successful in that.
All these things you're talking about take money.
Yes.
And we need to get that from the legislators. What's the temperature now?
Well, the session is going to be a full session, so we expect that it'll be a long session, and there are a lot of competing priorities, the McCleary education being one of the highest priorities. But we've already begun having conversations with our representatives and other groups to develop our agenda and to advance our priorities, and we recognize that if we don't end up paying for services up front, we pay for it on the back end of
Pay me now or pay me later.
Exactly.
And if it's later, it's going to be a lot more.
It is. The return on investment in behavioral health is significant, 7-to-1 by some estimates. Wow. And so we either pay for treatment up front, or we pay for incarceration or hospitalization or other problems associated with untreated behavioral health conditions.
And that sets up the revolving door.
Yes.
And we need to stop that.
Yes.
Jim Vollendroff joining us tonight on Recovery Coast to Coast, Director of Behavioral Health and Recovery Division in King County. The Legislative Forum coming up on December 7th. It's always a huge event, and they usually have some food and beverages to get things going. Everybody comes into the hall. We have a really spirited discussion of community mental health and the recovery process.
Yeah, we've changed the name a little bit to help reflect what we're actually trying to accomplish. We felt like, and this was from feedback from people who've attended the forum, that the name itself didn't fully explain what we were trying to do. So our tagline is a community conversation about mental health and substance abuse. And so that's what this is really all about.
The conversation needs to begin, needs to continue. And in years past, and I know it'll be the same this year, there are a number of new legislators recently elected. And when I see them sitting up there and their eyes get big and they think, I had no idea.
Yeah, I can tell you I have made lifelong connections of new legislators who want to know, want to be informed, and this is the very beginning of them understanding behavioral health and the challenges that we face in this state and this nation.
We have a lot of friends in the legislature.
We do have a lot of friends, fortunately, in the legislature, and it's become a bipartisan issue. This is not just a Democratic issue. We've got Republican friends who understand and who have family members. You know, recovery knows no bounds.
Yep.
So therefore, we all have a story to tell, whether it's about a friend or a neighbor or a coworker. We can all tap into the challenges of somebody who has an untreated behavioral health condition and what it means when they don't get help.
Yeah, and what it means when they do get help.
Yes.
The recovery process.
Yes.
Jim Vollendroff, nice enough to spend a little bit of time with us tonight on Recovery Coast to Coast. Where does the homeless situation fall into all of this?
Well, you know, we have a a crisis in
Yeah.
this country and in this city. I was just recently in San Francisco. They also have a crisis. And the King County Executive and the Mayor of Seattle have declared an emergency
Yeah.
related to it because we've got to come up with a creative solution. And one of those things is recognizing that there are root causes of homelessness. And sometimes, not in all cases, but sometimes it's untreated behavioral health conditions.
Absolutely.
And until we can create a delivery system, Neil, where people have treatment access when they need it, they don't have to go on long waiting lists, we're going to continue to have these revolving doors and cycles of homelessness. So that's a real priority of ours in King County, is to develop a delivery system of treatment on demand.
On demand, because it's such a shame when someone says, okay, fine, I'll do something about my addiction, and they're told, well, it'll be a 3-week wait.
Absolutely.
Not going to work.
A window closes.
Yeah.
For those of us in recovery, we know what that means. That means I can continue to use for a little while.
That's
and
right.
Sometimes we lose people
That's
in
right.
that time frame.
Absolutely. Jim Vollendroff joining us. Again, I want to give out the information for December 7th. It is going to be at Town Hall.
The website is kingcounty.gov/legislative form.
And right now there's 950, but there's room for you. And if for some reason they don't sign up, they hopefully can show up at the door. Maybe we can get a few of them in as well.
That's right. We do have some overflow room that we're planning
Yeah,
for
it's
that
going to be
purpose.
a great evening. Each year it gets bigger. Not only bigger, it gets better.
Yes, it does.
And when you see these legislators and they finally open their eyes, open their ears, and hopefully open the checkbook of the state of Washington to help people get better sooner and to stay well longer.
Yes.
Long-term recovery. That's what we're looking for.
Yes.
I'm Neil Scott, the program Recovery Coast to Coast. Nice to have you with us tonight. Stay with us on Recovery Coast to Coast.